this. So to take us through this and to tell us how it would be simple for our patients to follow, we have a very young and dynamic speaker. He is a consultant dietitian and also a lifestyle diabetes educator, Mr. Somendu Ghosh, and he did his MSc from KPC Medical College in Dietetics and Nutrition. So over to you, Mr. Somendu Ghosh.
Yeah, thank you, ma'am. Am I audible?
Yes, you are.
Yeah. Very good evening to all, and thank you, Diabetes Association, West Bengal Chapter, and Department of Endocrinology, NRS Hospital. So thank you all for allowing me to share my experience. As my topic is to talk about the simplicity of the diet. Let me share my screen. So hope it is visible. Yeah. So is it visible?
Yes, it's visible.
Yeah.
Yes,
Thank you.
Please go ahead.
Yeah. So I will be talking more simply in practicality of making a diabetes diet chart, and we will never call it a diabetic diet chart. We will always say it is a healthy, balanced diet chart. So whenever the diabetes comes in the patient's mind, the black and white comes in front of the patient's eyes. Patient loses all the colors of life. So it is our role to bring back the colors in the patient's life and to counsel them properly, that with a proper diet and a proper counseling, you can have each and everything which is healthy for you. And so I will be presenting with 3 case studies. The case studies are totally different, gender-wise, age-wise, and the BMI wise and the disease specification wise. Every case are different to us when the patient comes to our clinic. But the common thing among the 3 cases are diabetes. So what should we do? Should we give them the same calorie prescriptions, or should we give them the same menu plan? If the calorie is different also, so should we give them the same menu plan from early morning to dinner, including the lunch and breakfast? It will be a fixed menu for the patients. No, it is never. Every patient is different to us, so the dietary pattern is also different. So first we will go ahead with the anthropometry, then we will go about with the current report medication and the insulin the patient is taking. 24-hour recall, or we call it a dietary recall, is very much important. We have to check the patient intolerance, allergies, and food preference. Suppose the patient is intolerant to milk, or the patient is having celiac disease, and as patient knows that wheat product is good for us and we cannot take rice, the patient is forcefully taking the wheat product, so which is not advisable at all. So last thing is making the diet chart or the menu plan as per the patient's requirement, and also we have to check the patient's preference. So it is very clear that the diet charts or the menu planning will be personalized or customized. We cannot give any handouts or leaflets or a fixed menu plan to each and every patient. So we will go to a assessment plus. When the patient is sitting outside the clinic, we can ask the patient to fill by their own, or we can take help of our doctors, attendants, or nurses who can help the patient to fill this. So with the assessment, it will be very much helpful for us to go ahead with the dietary prescriptions. So along with the anthropometry, calorie calculation, the back calculation is also very important. Whatever the patient is taking from the early morning till bedtime, you have to calculate the patient's calorie and you have to modify accordingly, because you cannot totally change the patient's diet or totally change the patient's lifestyle drastically. You have to slowly modify the patient's diet, and you have to be a better counselor than a doctor or a dietitian. So we need to counsel the patients with giving our time. So where comes the role of a diabetes educator? So when we go for the assessment, we see BMI is not only the factor for obesity or underweight. And obviously, when we are going for the BMI, we will check for the Asian specific. So for us, not to notice 24.9 is not the normal range. Our normal range is 18.5 to 22.9. So when it crosses 23, so we call it overweight. So apart from BMI, what is important is the waist circumference, that is the central obesity. Many patients coming to our clinics are lean, obesity or the central obesity. So if we check for the Asian phenotype, Asians are mostly predominant in FTO genes, and there is the presence of central obesity in our patients. In spite of the low BMI, the South Asians have the thin fat, more insulin resistance, and higher level of C-reactive protein, low level of adiponectin, characteristic dyslipidemia, increased susceptibility to type 2 diabetes and coronary heart disease. So if you see, this is a common fruit, we call it pomelo or grapefruit. So if you consider the red portion as the muscle portions, and this is the fat, so this is the ideal, we need to build our muscle with the help of diet and along with exercise, and we need to reduce the fat, so which actually is detrimental. So if you see the 3% or the 3 patients, their BMI are same. So BMI is not only the factor to estimate the patient's is ideal weight or not. So if you see this yellow is the fat portion and this red one is the lean muscles. So if you see these first patients, the lean muscle is very less, where the fat percentage is high. So this will be the ideal when you build your muscle and the fat percent is low. So for example, athletes, you can see the BMI is high. So you cannot conclude that the patient is having high BMI, so the diet chart will be considered accordingly. So BMI is not only the factors. So this is a question for our educator: which person may have the low muscle mass? So what do you think? By seeing this, we can see this aged person or this geriatric patients having the very less muscle mass. So we will conclude that this patient is having very low muscle mass. But no, the answer will be for the both, because the high body weight or the BMI does not preclude the presence of low lean mass. So now time for our dietary modifications. So as we see in the Asians or the traditional Asian Indians are carboholic. Sometimes we see the patient end up with 70 to 80% of the macronutrient comes from carbohydrate, and which increases the risk of the postprandial glycemic response. So what ADA is saying, the current guideline 2020 says that there is no fixed carbohydrate, protein or fat percentage we should prescribe the patients, but it should be individualized or it should be customized. So if we move to the other guidelines like Canadian guideline or ICMR guideline, it ranges from 45 to 60%, and it should not exceed above 60%. And depending on the patients, we can give the low carbohydrate, good fat, and good quality of protein in their diet. So in a 2000 calorie diet charts, the carbohydrate should be 225 to 300 grams, protein should be high, 75 to 100 grams. We can prescribe up to 80.8 to 1 gram per kg ideal body weight protein, but if it is required, we can increase the amount of protein accordingly. So carbohydrate should come from the high fiber foods, and we should mix the carbohydrate. For example, we are not nowadays not using the traditionally used whole wheat flour. All are commercial whole wheat flour we are using. So we can make it high fiber by adding ragi, jowar, bajra, oats, and make it a high fiber cereals, and with that we can make our chapatis or roti in our household. So it will be high fiber things. And the protein should comes from the high biological value protein. Pulses are always good because of the amylose content, and the carbohydrate digestion is very slow in the case of pulses. So we need to check for the protein quality. Not all protein are high biological value protein. So we have to check for the PDCAS value of the protein. PDCAS is protein digestibility corrected amino acid score. So among these, egg and milk is having the highest protein absorption, which is 1, and you can see mutton or red meat, which is having 0.92, and the dals and pulses, which are having the 70% of absorption of protein. So if you consider egg and milk, these are almost the 99% of absorption of protein. So we can consider giving our patients. And egg is not bad. the patient having a myth that patient throw away the egg yolk and the patient tends to have the egg whites, but the egg yolk is a lot of vitamins in this, choline, vitamin D, everything is this, and it is having very low GI. So we can give a boiled egg without salt in the mid morning or the midday or the evening, so it will not increase your blood glucose level. So coming to the fat, the patients always, when it comes to our clinic, always ask which oil should they use. So the visible fat total consumption should be 20 to 25 ml of fat, and it should not exceed more than 30 ml in our daily use. But when we counsel the patients, a household member, there are 4 members and the patient are using almost 8 liter or 5 liter of oil. So too much of oil can be detrimental, and sometimes what happens, the dietitians give a diet chart but forgot to write the amount of oil. So it is my advice that we should always tell the patient to use mixed oil. And if you see the commercial oils, also packet oils, most of the branded companies, the rice bran oil is 70% and mixed with other oil that is 30%. So we can advise to have rice bran oil 60 to 70% in the household, and 30% of mustard oil can be used for our population. Saturated fat should not exceed 10%. Trans fat should be 0 or less than 1%, and MUFA should be 10%. So we can have good quality fat like nuts and oil seeds that I will discuss in my following slides. Vitamins and minerals, that is whole fruits, is always advised than fruit juice. Vegetables, raw vegetables, we are not advising because of pesticides. So cooked in very low oil, or you can have green salads that are very good for you. But there are some fruits which is written like mango, banana, chiku, grapes, custard apples should be restricted. So I think there is a trick for the patients that in a tricky way you can prescribe mango, because mango comes in a season. So you can encourage your patient that if they control their blood glucose level, and if they check their with the help of glucometer, if they are checking and if it is low, so you can prescribe mango, and you can cut down chapatis, or you can cut down rice and make it balanced. So you can include mango also, you can include banana also. Sometimes I give banana to the patients who are outside, and those who munch on biscuits as a street foods, or those who goes to the egg roll vendor and taking an egg roll. So when you are in empty stomach, you can have 1 or 2 bananas. That will be good for you than having the outside foods. So spot the difference. What is the difference between the 2 plates? These 2 plates almost look similar. So what is the difference? This is 780 calorie and this is 400 calorie. The difference is the cereals. So we need to educate our patients that they need to minimize the amount of cereals and increase the vegetables. For example, in these 3 plates, if you see, this is also a full plate, this is also a full plate, this is also a full plate. So all the plates will fulfill your appetite. But the most important thing is you need to reduce the amount of carbohydrate and you to increase the amount of vegetables or the dietary fibers. So if you see this, what I think is a serving of rice is an actual serving of rice. What is, because only by reducing the amount of rice, the calorie goes is 110 calorie, whereas the amount of rice is 1 cup, which gets 220 calories. So we can give a balanced diet like this. We, instead of giving 2 or 3 chapatis, you give 1 chapati, curd, vegetables, dals. So this will a wholesome food, and which is a balanced food. So this is the easy way in our clinic. This is the tips for the patients, that showing our hand palm, that is this amount of vegetables. You can have 2 handful of vegetables, this amount of cereals, this amount of a fistful of fruits, that is 2 servings or 3 servings of fruits, and very less, that is fingertip of oil. This oil should be very less in our diet. These are the measuring tools, though previously I don't use this amount of this kind of things. I ask my patients to go to the vendor and measure the amount of the cereals, and then come back and cook and give the measurement. But these are the very easy tools nowadays available, in online shops also. So where you can, these are very helpful tools to see the measurements of the amount of cereal, pulses, or even the fruits. And these are the different types of spoon size. These are the spoons, and this spoon I asked my patients for the salt, that is not less than 5 grams of salt should be used for our daily intake, and the sodium should be limited to 3 grams. The patient is limiting salt, but what our previous speakers has already, Dr. Goswami has said, that all the commercial foods having high amount of sodium. So we need to give these tips to the patient that you are minimizing the amount of salt, but you are consuming the commercial foods, or you are taking the snacks in the evenings which having the high amount of salts. Next, these are the measuring cups. These suppose a diabetic CKD patient is having this amount of tea, you can ask to reduce the amount of fluid. When you can ask that you have to reduce the amount of fluid. So these are the measurement of fluid, which are very helpful tips for the patients. This is a very helpful things. Even I use it in my household to catch the vendor. If in the fish, especially the fish vendors, those who are giving fish to me, I again come back to my home and weighing the fish, and next day I catch the fish vendors that there is 250 or 100 gram or 150 gram less. But for our diabetic patients, if you are suggesting only one apple, you should also tell the apple size, that apple should be 150 gram or 250 gram of apple. So these are the tools which can be used easily in the household for the patients to estimate for the better glucose response and diabetes control. So now the challenges come. So I am sharing, why I am sharing these pictures of roti and cereals. When you say 1 cup of rice, take 1 cup of rice, you don't know the cup size or the katori size of the patient's home. So you need to say about the grams in like for this much of 75 gram of raw rice or 50 gram of raw rice need to be measured at least for 1 day, and then they can cook with the other family member. Roti in India, chapati in India are different forms. So I am sharing one example shared by one of my senior dietitian colleague. She has counseled one patient. He is a taxi driver from Bihar, and he said that, ma'am, I am checking only 10 chapatis in a day and not more than that. That is approximately 3 chapatis in breakfast, 4 in lunch, and 3 in dinner. So why my blood glucose is raising? So the dietitian ma'am asks that patient that it is not important that how many chapatis you are consuming. It is very important with how much atta you are preparing that chapati. So in our general household, we prepare 25 to 30 gram one chapati. But what the driver answered is very strange, and it is not strange, it is very practical. He said that I am consuming 10 roti from 1 kg of atta. So that means 100 gram of cereal he is using for 1 chapati. So he is consuming 1 kg of atta in the whole day. So this is a very important tips for the educators to counsel our patients, that we should be amount specific and not the quantity. This is also a size of chapati. This picture is taken from the Dr. Mohan's food atlas. This is also a very good tool for us as a dietitian to counsel our patient to show the raw foodstuffs. So it is a 50 gram atta dough. We make it is a dough and we can divide it into 2. This is the practical example to show you that is 25 gram of atta dough and making 1 roti from this 25 gram atta dough. This is the 50 gram of rice, and after cooking, this is 1 katori of rice. So this is a practical examples. So now making our diet very simple, we need to advise, because we cannot complicate the patient's daily life. We need to counsel the patient in a very simple way, and we should say our patient that in a 9-inch plate, 50% of the plate should be vegetables, 50% non-starchy vegetables and cereals, 30%, and rest is protein. And you can add milk products like curd along with the diet. You add the fruits in the mid-morning. So the timing of the patient is also very important. The gapping should be 2 to 3 hours gap in between the meals. So snacks is very important. Patient usually do not take breakfast, or they delay in breakfast. Patient are not taking snacks and taking a heavy lunch, and then PP glucose response is high. So this is the example of the breakfast which patient usually consume in their household, where you can see the calories comings are very high. It is nearly 350 to 400 calories in all the meal. This is a very common thing. Patient is having toast with omelette in the breakfast. So how we can modify and minimize the calorie or the GI of the food? So to modify, this is the modified diet. This is a wholesome dalia with lots of vegetables. This is a oats porridge, or you can, if the patient do not like to have oats with milk, you can advise them to cook like this with vegetables and to have, because oats is having low glycemic index and high fiber, so it is very good to control the blood glucose levels. You can ask the patients to take chapatis, lot of salads, vegetables and eggs, so you can see the calories is reduced to 150 to 200 calories within that. So this is one example I have prepared for you. This is the oats and atta. I usually ask my patient not to take only atta, use the grinded oats powder or jowar powder with atta, or plain sattu mixed with atta, and make chapatis with vegetables. This is very easy to make also, and this is a wholesome breakfast or dinner. If the patient do not want to prepare it like a dough, so the patient can make a batter of it and cook in very less oil, like this kind of chapatis can be prepared with salads and curd. It is a very wholesome breakfast. So breakfast should not be only cereal. Breakfast should not be skipped. Breakfast should be with a high protein. It can be with curd, it can be with a boiled egg, it can be with a few pieces of paneer. So breakfast and dietary fiber should always be there in the breakfast. So we should advise this to our patients. So this is the patient's lunch, where you can see the amount of rice, and there is very less vegetables. Sometimes dal is there, sometimes dal is not there, and the 1 or 2 pieces of fish usually we can consume in our daily household. Now you can modify the patient by saying that eat more of vegetable, less of rice. The amount is same, so there is no question of fulfilling your appetite. So generally I don't advise my patients to cook this much or this variety of vegetables. At least cook only one vegetables. Maybe it lauki, maybe parval, maybe green papita. Make one vegetables. No need to cook 2 or 3 vegetables. But take 1 katori of boiled vegetables, 1 katori of dal, very less amount of rice, curd, and a protein options, that is fish. And obviously the meal should start with a plate of green salad. We should not take the rice first. We should the tips is that we should first take the salad, then the curd, then vegetables, and gradually end up with taking very less amount of rice. And if it is an overweight patient, you can even skip this, right? And you can give this wholesome plate to the patient. So you can see the calorie of the lunch is almost 330 calorie. So now our patient, what they do not cheat in the lunch or dinner. That patient usually cheat in the evening snacks. If it is a corporate patient, then he or she will take the outside food, or if it is a sedentary housewife, then they will have samosa, they will have jhalmuri with chanachur and all these. So and ultimately there is a lot of calories coming in the evening snacks. It is better to advise the patients to have some tasty foods which they can prepare, like green gram, like moong, chana, chickpeas, kidney beans. These are the sprouts which are very healthy, with some salads, squeeze some amount of lemon in it, and you can have in the evening. You can have a high protein diet, that is in the evening you can have chena, you can have muri or chira, but it should be mixed with salads, then you can consume this. So the evening snack should be light, and you can encourage your patient for early dinner, and they can have a very simple dinner which should be within 250 to 300 calories diet. And again, you should need to emphasis on protein, because 1 gram per kg body weight protein is not a very easy task to meet up. So you need to keep protein in each and every meal throughout the day. So now, traditionally, what we have described earlier also, anti-diabetic medicinal plants in Ayurveda, there are many medicinal plants, or what Dr. Goswami has said that about the spices, all Indian spices are very good, more or less, if you consume in our daily households. So one very useful spices, that is cinnamon. Cinnamon helps in reducing the gastric emptying. It decreases the glucosidase enzyme activity and reduces the PP blood glucose. It stimulates the pancreatic beta cells in increasing the insulin sensitivity is also there. So how much cinnamon we should take? Everything what we should take is very important, that we should take the advice of the endocrinologist or physician, and without that we should not take, because it has an effect with the insulin or insulin secretagogue. So it can lead to hypoglycemia, even the fenugreek. There are many studies are showing that excess amount of fenugreek intake by the patient can lead to hypoglycemia. So we should be very cautious before prescribing this kind of herbs. And the many studies are concluding that 12.5 gram to 15 gram of fenugreek powder before the meal is very good in lowering the blood glucose level. It is both important for type 1 and type 2 diabetes, and fenugreek seeds can improve most metabolic symptoms as well. So this is another herb which we can use in our household, and especially I encourage my patients to have readily or easily available oil seeds, because many of our patients are not economically sound to buy chia seeds or flax seeds. So we can encourage our patients to have the pumpkin seeds. When we go to the vegetable vendors, the vendors usually throw away these seeds and give us the pumpkin. So we can soak it, we can sun dry it, we can make it a powder, or we can have it like this. We can also cook it and we can have it till what we call the sesame seed. White sesame seed is also very good, and it is very high in fiber, which when consumed, this seed may ensure slow release of glucose in the blood, thus preventing any spike in the blood glucose. So another important thing is, instead of biscuits, nowadays I am giving nuts in the early morning, because biscuits at any form is not good for our patients. So if we advise our patients to take handfuls of nuts, it is always good, like almonds, walnuts, pista. These nuts are low on glycemic index, and which mean your satiety value will be high, and which body also absorb the carbohydrate very slowly. And even these nuts having studies are saying that's good effect in cholesterol lowering, especially the low density lipoprotein. So why only almonds and walnuts? Our very easily available low cost nut is also there, that is peanut. Peanut is having a high amount of magnesium. So peanut may also help lessen the insulin spike of higher glycemic food, and when paired together. For example, I do not encourage patient taking bread always, but if you are taking bread, you can have some peanut or peanut butter, so which ultimately will reduce your blood glucose level. And one reason that peanut may help control blood glucose level because of the content of magnesium. And magnesium, according to the report by the Journal of Internal Medicines, helps to maintain blood glucose level. Also peanut is very good for cardiovascular patients, or the lowering the hypertension. So peanut early in the morning, soaked peanut, peeling off, you can advise 6 to 7 peanuts or 4 to 5 almonds early in the morning before starting the day. Or in the mid morning or in between the meal also, you can encourage taking nuts, because especially patients munch on biscuits, so we should discourage taking biscuits. Chromium is also supplementation. There are many studies showing the supplementation of chromium is very good, but I will not go to the direct supplementation. I will ask the patient to take from the readily available foods like the cruciferous vegetables, broccoli, cauliflower, onions, cheese, eggs are rich in chromium, and chromium also helps to reduce the blood glucose level. And many diabetes specific nutrition supplements are nowadays claiming for high chromium to reduce the blood glucose levels. Now coming to the most important fact, that is reading of the nutrition labeling. Reading of the nutrition labeling is the most important tips for our patient, because we should encourage our patient whenever you are buying commercial foods. So we should read the nutrition level, see the changes. This is a per 9 cracker, 23 gram. This is a 20 gram cracker. So both the cracker in gram wise, they are equal. But see, these calories are also same. Both the crackers having the same amount of calorie, 90 and 90. See the saturated fat where it is 13%, where it is 2%. See the amount of sodium, it's 12% and 4%. See the amount of fiber, and see, so it is very important that we should read the nutrition labeling. Especially we should read the cholesterol level, sodium level, how much preservative is being added. In spite, except for checking the date, expiry date and price, we do not read this nutrition labeling. So we should encourage our patient to read the nutrition labeling of the different commercial foods. It is very, very important tips for the patient. Another important is to read the glycemic index of the food. That's less than 55 is less glycemic, 56 to 69 is medium glycemic index food, and more than 70 is high glycemic index food. So if you even combine this high glycemic index food with the other vegetables or low glycemic, you can have this sometimes also. So factors which influence glycemic index of the foods are cooking, processing, degree of ripening, sugar content, acidity. So I will just go through the slides that if you see the degree of processing glycemic index, how it increases. If you are having whole wheat, it is a very low glycemic, then cracked, then coarse, then it is refined, that is maida, it is having the high glycemic index. So degree of processing of the same cereal increases the glycemic index of the food. So this is also tips for the patient. Soluble fibers is present in fruits, it's present in oats, it's present in different types of beans. A soluble fiber, we should always encourage our patient for glucose lowering. It is a very interesting fact that is different between amylose and amylopectin. Amylopectin is a branch chain, whereas amylose is a straight chain. So if you see the long rice, these are contain high amount of amylose, whereas the short rice having the amylopectin, even wheat or the refined wheat are having the amylopectin. Amylopectin are readily absorbed in the blood, whereas amylose have a slow digestion. So it is advised to take the amylose rich food than amylopectin. Now coming to the ripening of the food, the more it gets ripened, more is the increase in the glycemic index of the food. So we should take the less ripened food, so then we can enjoy the fruits also. For example, banana, which many patients as a layman thinks that I cannot have banana, but patient can have banana, but you have to give the idea how to take this. Another thing, this acidic medium, for example, vinegar, apple cider vinegar lowers the glucose response. So sometimes if you add a tablespoon of vinegar in the rice, so it lowers the glucose response, as some studies are showing. So we should avoid the same oats. If you see, this is a commercial oat having high glycemic index, whereas the traditional oats or traditional cereals having a low glycemic index. Another important thing is glycemic load, because glycemic index is the only quality, whereas glycemic loads gives you the quantity and the quality of the food. So glycemic index is nowadays more encouraged on the glycemic index. And if you see the benefits of glycemic index diet, so you can see it lowers the cholesterol level, risks of heart disease, weight management, and type 2 diabetes. I am not going into details about the carbohydrate counting, but carbohydrate counting we should teach our patient, especially the gestational diabetes patient, type 1 patient, and the patient on insulin. They should know about the thing of carbohydrate counting, because it is very important to adjust the insulin dose depending on the amount of carb consumed. So another important thing is reduction in the weight, that is 5 to 10% of the initial reduction of the body weight improves the insulin sensitivity, glycemic control, blood pressure, and control lipids. So we should encourage our patients to reduce their body weight, especially central obesity. So coming to the end of our slides, these are the tips we should implement We should encourage the patient in the office. Do not sit in a chair for the whole day. You can you can use the stairs instead of using the lifts. You can advise the patient in the summer, instead of having colas, you can have Dove water or coconut water to quench your thirst. These are the very simple tips you can give to your patients. In spite of high calorie food from the vendors, if you are using your canteen, office canteen, you can have the fermented food like idli, plain dosa or dhokla. That are also street food, but that are low in glycemic index or low, and that can be prescribed to our patients. So exercising.
Mr. Ghosh, sorry to interrupt. Can we finish it off because we are running behind time?
It is the end of our slides.
Thank you.
So tips. These are the tips, and the last thing I will say that white culprits. So we should avoid sugar, salt, and the maida, that is the refined flour. These are the white culprits. So we should advise the patients. These are the things I have already described, so I should not go into details. What are the things you can have in the roadside instead of what you can keep in your lunch box or you keep in your office desks? These are the simple things. Try to limit these things like pastries, burgers, and this, and you can have multigrain sandwich, salad burgers, or this, and you can try instead. Alcohol is always in limitations, and for the gestational diabetes or pregnancy, we should avoid alcohol totally. Smoking in any form should not be encouraged. And during our counseling, if you ask your patients that, are you a smoker? Patient will say, no, I am not a smoker, but the patient may be taking tobacco in some other forms. So it is very important to counsel the patients to not to take tobacco in any forms. So concluding my talk, we have to take our medication and insulin. Diet is very important, exercise, and need to reduce the stress. So according to famous nutritionist Dr. Arnold, eat little bit of everything, but not too much of nothing. A good diet is a mixed diet. So thank you very much for your patient hearing.
Thank you, Mr. Ghosh, for your excellent presentations. So we have lots of questions. I'll just put up one because of lack of time. So somebody has asked whether jaggery may be preferred over sugar in patients with diabetes.
No, directly we should not, because jaggery, from jaggery we are getting sugar. So directly, if we say to our patient that you can have jaggery instead of sugar, the patient will start having lots of jaggeries. So
yes, so that is a wrong message. Yes.
That is a wrong message. So the simple sugar, any forms we should try to avoid.
Okay, thank you. Thank you so much for the excellent presentation. Now I hand over the session to Dr. Rahul. Rahul.
Thank you, ma'am. Thank you, sir. Without further delay, let us go into our final session, which is the controversial one. May I request Dr. Shomoprato Roy Chaudhary, sir, who is a consultant